educator. Mike served the initial glitch, so I think it's now, and let's see how it goes. Right? Fortunate that we don't have stable network in the country. Stable, very stable, or probably depends on the area. I don't know, but it's unfortunate for this glitch to have happened. So this is Healthy Living Global, as you all know. I'm Health Educator Mike, the Health Educator of this Healthy Living Global. So we are bringing you health tips. That is our work. So I started with um, explaining other things we have been doing before now. All right, we have discussed a lot of things on this particular channel recently about this structural defect, um, which we is a challenge to a lot of people in Nigeria and even outside Nigeria. So it's actually a challenge. So we want to know the causes and also possible ways by which we can prevent them. All right. So if you check all these structural defects, we started from congenital issues, which you mentioned that of spinal bifida, anencephaly, you see clubbed feet, knocked knees, that's many of them we have discussed, cleft palate, cleft lip. All right, we'll discuss a lot of them, of which we see that many of them is caused by, it can be from folate deficiency, it can be a sort of genetic disorder. All right, it can be a sort of maternal intake of something like alcohol, smoking, and so on. It can be some certain medications that the mother is using, right? It can even be maternal diabetes, right? All those things can be the cause, even maternal infection, which I always encourage that you treat infection prior to any conception to be on the safest side. All right, so we have discussed a lot of them. So today we are going to discuss about rickets and osteomalacia, of which I established that rickets and osteomalacia are very much related. That of rickets happens in children, all right, those that their growth plate have not closed, right? So they are still growing, which is to say that the growth is still in progress. And what happens is that this ricket can lead to softening and weakening of their bones, all right, causing a lot of structural issues. I believe you must have seen someone that having ricket, and that of the adults, which is osteomalacia, that one their growth plate have closed, they are no longer growing, and suddenly they begin to notice softness of bone, um, even weakness of bone, all right, pains in the bone and even the muscles of the bone, all right, leading to different shapes, all right, making them to have different shape, as in deformities, you understand, so which at the end of the day can impair their social life, right? It can make them to have personality issues, right? So all those things are the things that we're expected to know. So the causes of this ricket and osteomalacia is related, right? So the only difference or little difference is that of ricket is one of the major causes is a lack of exposure to sunlight. Of course, you may not relate that to adult, unless anyone that is staying indoor, right? So now let us now discuss them one after the other and also relate them, put them together. Now, this ricket, right? With the possible causes, it could be vitamin D deficiency, right? And it could be calcium deficiency. Of course, what does vitamin D do? Vitamin D helps in the absorption of calcium. So when the two are deficient in the body, it can lead to even osteoporosis. It can lead to weakness of the bone. it can lead to, of course, you know what calcium do, strong bone and teeth. That is what I think elementary aspect of biology will tell us, that even integrated science in junior class will tell us that, right, that calcium is for what? Strong bones and teeth. So if there are no calcium absorption, all right, it can lead to all those issues with the structure of the person, all right, which is in form of rickets. So it could be caused by um, this calcium deficiency, vitamin D deficiency, could also be caused by phosphate disorder. All right, all of them are minerals. When you are having phosphate disorder, you are lacking minerals in the bone. All right, so if there is no enough minerals, that is what hardens the bone and make it to function properly. If you are not having phosphate, vitamin D, and calcium, just know that what that is for the children, right? You will develop rickets. If you are adult, you are going to develop osteomalacia. Take note. Another thing that could cause it also is certain kidney disease. All right. If you are having, there's some certain kidney disease that lead to destruction of vitamin D. All right, it can lead to what? The destruction of vitamin D. And of course, it follow the same line, right? If there is no enough vitamin D, it can lead to what? Lack of absorption of calcium and so on. Before you know it, leading to what? Weak bone, pains in the bone, and so on. All right. Is part of what? Nutritional issues. All right. All this one, like this osteomalacia and this ricket, is what? Nutritional issues or structural defect that is caused by nutrition, right? So it's based on what you are eating now or what you did not eat. That is what have caused this. Now another thing we are going to mention is what? Intestinal disorder. If you're having a condition like celiac disease, right, where the gastrointestinal area is inflamed, the normal um, areas of the gastrointestinal, the wall of the gastrointestinal that is positioned, all right, because it have some should I say some filia, you're like a filia shaped structure, all right, in the wall of the stomach that helping in the absorption of nutrients. All right, so is positioned in a way by which it can absorb nutrient from the food you are taking. All right, like you take carbohydrate, it will absorb it, take it into the system. Of course, there is no pipe that is channeling from the gastrointestinal tract into the blood. All right, so it's through that small um, um, that filia or that small structures, right, built in the wall of the stomach are helping what? In the absorption of that material. So that's what happened in celiac disease when the that particular structure is having an issue, and before you know it can lead to that particular celiac disease. Now if you're having celiac disease, it can lead to lack of absorption of phosphate, vitamin D, and calcium. And once these three things are not absorbed well from the nutrients you are taking, there is a problem. It can result to ricket. That's the reason if you see like um a place, all right, maybe in rural areas, you are going to see a lot of people that are malnourished, all right. Their own reason or their own case is very different. They are actually taking the the food, but the food they are taking have very little of this calcium, vitamin D, and phosphate. But in some areas, they have food that are rich in calcium, phosphate, and even vitamin D, but because of celiac disease, it cannot be properly absorbed. That is where the issue is. All right, so please take note of that. So that of celiac disease, that of ricket and osteomalacia, I say that what it is related. That of osteomalacia happens in adults, and that of rickets happens in children. So the another causes again, or one of the cause again, is what lack of exposure to sunlight. No, the child is always indoor. It's not going to be of a help, which is the reason sometimes you tell the patient come out under the sun, and it must not be any type of sun or any period of the day. Let's say afternoon, 1 p.m. to no. Let's say 9 morning sunlight, 9, 10. All right, that early morning sunlight is very rich in vitamin D, right? Because of that early morning sunlight is going to supply the person with enough vitamin D needed in the body, and before you know it, the person can overcome this ricket. Now, another thing is this osteomalacia. So, if you have understood it, both of them, because this is nutritional issues, right, that is capable of causing structural defect, all right, making someone to have different shape. If the bone is weakened, if the bone is now becoming soft, before you know it will be able to break more easily. All right, all those things can have a lot of issues in someone's structure. All right, so that is the issue. Now, if you want to prevent this, to have mentioned the cause, if you want to prevent this, it's just as simple as anything. You just make sure you are taking enough vitamin D with calcium, all right, and phosphate. Make sure that your food is rich in all these vitamin D, calcium, and phosphate. So, which is to say that you are going to take balanced diet. And if you are not in prison, please regularly come out under the sun, right? So that you will at least see the sun of the day, especially early morning sunlight, and not to always be indoor. It's not going to help. All right, you are not strengthening your bone. I've mentioned, I say that early morning sunlight have um is very rich in vitamin D, so everyone needs it. And with the vitamin D, it will help in the absorption of calcium. All right, so please take note of this. Osteomalacia, rickets can actually be prevented with adequate diets, balanced diet that are rich in protein. All right, diet that even all these fruits, diet that you can obtain calcium from, diet you can obtain vitamin D and even phosphate. That is the diet that is recommended. All right, so and most of the time you may need supplement. All right, you may need supplement, especially for those that have developed it already. You may need what supplement. All right, if your own condition requires supplement, fine. All right, you go for supplement. So if you are this kind of person that is always having pains in the bone, very severe pain in the bone, all right, and also you are having a kind of some weakness in the muscle, you can proceed, let them do some checkup to know the level of minerals in your bone, all right, or your system, to know what is actually happening. Probably maybe osteoporosis or maybe osteomalacia. So and that is the issue. But if you handle it with supplement, it's going to be corrected at once. All right, because some people may end up being on wheelchair if this is not handled adequately. All right, so just like I usually say, I said prevention is cheaper than cure. When you detect it earlier, you handle it earlier to avoid loss of bone mass, right? Because with this, you are losing what your bone mass with a lot of issues. All right, so prevention is cheaper than cure. That's just what we are going to just have the brief discussion for today, ricket and osteomalacia. And if you have anything, any question to ask about that, you'll put on the comment section, guys, and I'm going to see you Anytime I see notification, I'll come and answer you. So do well to be part of the live streaming. Just like I've been saying, and I'll still say it now, I have a link to surgeons that can correct, in fact, any kind of defects that you can think of or you have ever seen in this life: scoliosis, lordosis, kyphosis, any of these structural defects, all right, can be corrected through surgical procedures, all right? Very sophisticated one, plastic surgery, all right? So is one of the modernized surgery, and there I have the link, and that is India. So but I am trying to see if I can get good surgeons in Nigeria that I can have their contact also, in case if we have um anyone that needs this particular attention or this surgical procedure, so that the person will be attended to in Nigeria instead of going to India. All right, so please, everyone should take note of this and do well to reach out to me if you're a good surgeon, certified surgeon, as in fact, certified and also practicing. Your certificate is speaking, and even your practice and your mode of work is speaking it out that you are a surgeon. You can reach out to me so that we get your details down. All right. We want to see how we can partner with healthcare providers, healthcare consumers. Let all of us work synergistically to help in the growth of our health or healthy life. So please let us take note of this, and don't forget to share this video and also subscribe to our YouTube channel for a video like this. I am Health Educator Mike once again. For those who do not know me, that is me, Health Educator Mike. Some people will be like, are you a doctor? I'm not a doctor, I'm a health educator. All right, so we have a lot of things to tell you. I'm an educator, so I educate you guys. That's what I do. I'm not a medical doctor. So that is it. If you need any information, you want to ask about anything, you need inquiries of anything, or even want specific treatment to do on a particular issue, I can be a guide to you. All right, that is my work. I'm also a healthcare manager. Let me not forget that, and also health education, which is health education, a health educator. All right, because I am doing health education. So take note of that. If you want to reach out to me, 07088611262, 07088611262. Sorry for the whole distractions of today's live streaming. We have started the first one, broke that one. We'll have to cut that one off or start again. Network going here and there. I believe tomorrow is going to be a better day for this live streaming again. So it's every day by 10 a.m. Stay tuned, be part of this live streaming, and we're going to take this platform to a greater level. All right, someday. Thank you. See you guys tomorrow.